Can vertigo itself or the vestibular disorders lead to other complications like a slurred speech, a deafness, even, something like a depression or anything?
So this is kind of a tricky question because there's a lot of different parts to it. So the first part of it is really going to be important to understand. So slurred speech and dizziness is nothing to mess around with. So vomiting and nausea frequently are accompanied or kind of pair up with vertigo, and usually they're nothing to worry about. But vertigo can be really dangerous, meaning that it has something to do with the brain rather than the inner ear when it's accompanied by double vision, slurred speech, weakness, or even numbness in the face, clumsiness, or even falls. So, when you're specifically talking about slurred speech, that's going to be paired into a dangerous part of dizziness. So, people who have vertigo, dizziness, that severe imbalance, usually that's kind of our red flags for stroke. Patients will report, weakness on one side of the body. And so when that vertigo and dizziness occur together, in addition to the slurred speech and the weakness on one side of the body, that's a pretty big indicator that you need to seek medical treatment right away. Now, with regard to deafness in particular, there are certain types of inner ear disorders that will cause a change in the hearing and the balance organ. Meniere's disease in particular, so that's going to be a disorder of the inner ear. It causes these really severe bouts of vertigo or dizziness. You'll also get ringing in the ear with hearing loss. And then most of the time, patients are going to say they have like a fullness in the ear or like the ears feel really congested. Typically, it's only happening on one side of the system. So, right ear would experience those symptoms or sensations, or the left. There's also a different condition, a sudden hearing loss, which would affect the hearing and the balance. Usually, the sudden hearing loss is going to come from a viral infection of the hearing nerve. And usually, it's swelling that occurs in that affected nerve and causes it essentially to kind of narrow. Labyrinthitis is the inflammation of that part of the ear. And it's really important, to really understand kind of what's going on in the system, because when they pair up together, whether it's causing the sudden hearing loss or the sudden change in balance, you need to be evaluated.